Hello family! Welcome to X Details. In today's video, we are going to talk about one interesting but slow killer disease known as diabetes. If today happens to be the first time watching my channel, kindly subscribe so that you will get all my interesting videos. Let's get started. Diabetes itself is a condition where the body glucose, which is known as blood sugar, is too high. And glucose happens to be the main source of energy in the body. Certainly, it's a chronic medical condition where your body either doesn't produce enough insulin or can't use the insulin it produces effectively. Insulin is a hormone that helps glucose from the food you eat get into your cells to be used for energy. We've got some types of diabetes. Type 1 diabetes, which is an autoimmune reaction where the body's immune system attacks and destroys insulin-producing cells known as beta cells in the pancreas. So the body stops producing insulin for the body as required. It's typically diagnosed in children and young adults, but it can certainly occur at any age. And this type mostly requires lifelong insulin therapy, blood sugar monitoring, and lifestyle adjustments. Then we have type 2 diabetes. With this type, the body becomes resistant to insulin. Over time, the pancreas can't make enough insulin to keep blood glucose levels normal. It's more common in adults, but increasing in children and adolescents due to rising obesity rates. And it's well managed through lifestyle changes, diet and exercise, oral medications, and sometimes insulin. We also have this other type known as gestational diabetes. This occurs during pregnancy when the body cannot make enough insulin. It starts to develop during pregnancy and usually resolves after childbirth. It is well managed through diet, exercise, and sometimes insulin or medications. This type of diabetes usually increases your risk of developing type 2 diabetes later in life. There are some common symptoms of diabetes that you need to know in order to easily identify what your body may be going through. These symptoms include 1. Increased thirst. 2. Frequent urination. 3. Extreme hunger. 4. Unexplained weight loss. 5. Fatigue. 6. Blurred vision. 7. Slow healing sores or wounds. 8. Frequent infections. These symptoms can be concerning. To diagnose diabetes, we perform some blood tests to measure your blood glucose levels. And the tests are requested by your doctor, which are 1. Fasting blood sugar test. It's done by taking your blood sample to measure its blood glucose after an overnight fast, first thing in the morning. 2. A 1C test. This provides your average blood sugar levels over the past 2 to 3 months. 3. Oral glucose tolerance test. With this test, blood sugar is being measured before and after drinking a sugary solution. Upon diagnosis, effective management of diabetes would be required, and this involves 1. Regular monitoring blood sugar levels. 2. Healthy eating, which should include a diet rich in fruits, vegetables, whole grains, and lean proteins, and low in processed foods and sugars. But note, fruits high in sugar should be taken in moderation. 3. Regular physical activity. 4. Oral medications or insulin therapy to help control blood sugar levels. 5. Diabetes education programs and support groups like family members or people suffering from similar condition can help manage the condition. You may ask if it is possible to manage diabetes without medications. Yes, in some cases, especially in early type 2 diabetes, lifestyle changes alone can be very effective. However, many people do need medications to keep their blood glucose levels in check. But if it is not well managed, untreated, or poorly managed, can lead to serious health complications, such as 1. Heart disease and stroke. 2. Kidney disease. 3. Nerve damage neuropathy. 4. Eye damage retinopathy. 5. Foot problems, potentially leading to cutting that part of the foot off, which is called amputation. That's why it's important to manage it well. What then can you do to prevent these complications? 1. Regular monitoring of your blood glucose levels. 2. Adhering to your treatment plan. 3. Making healthy lifestyle choices are key. 4. Regular checkups with your healthcare provider are also important to catch any potential issues early. 5. Maintaining a healthy weight. Know that early intervention can help manage or prevent future complications. To conclude, be more informed and ready to take control of your health. Remember, managing diabetes is a team effort with the use of the right tools and support. You can live a healthy, active life. Diabetes is a serious but manageable condition. If you or someone you know is experiencing any of the aforementioned symptoms, consult your healthcare provider ASAP. Early diagnosis and proper management can make a significant difference in your quality of life. Thank you for your time. Kindly subscribe, like, and share to save one's life. Bye.